Can everyone see that and hear me okay? Yeah. Brilliant. Well, thank you for listening to me today. My name's Katja, and I'm Katja Milner, and I'm a final year ESRC PhD student at the University of Nottingham. I'm going to very briefly summarise the first part of my PhD research, which is exploring the role of spirituality in mental health and recovery from the perspectives of people who experience mental health difficulties. People connect with spirituality in both religious and non-religious ways, and research highlights its importance in mental health and recovery, including in supporting positive health outcomes. Research also indicates that within clinical contexts, healthcare professionals often undervalue dimensions of religion and spirituality. This is sometimes referred to as the religiosity gap, and may be due to a lack of training and understanding about the topic. My research is exploring what can help to bridge this religiosity gap. And to support this aim, I conducted a qualitative systematic review to characterise the experiences of spirituality amongst adults with mental health difficulties. 38 peer-reviewed journal article studies were included in the review, covering a broad range of countries, beliefs, and mental health difficulties. After conducting a thematic synthesis, 6 key themes were found, which created the acronym MYSTIC. These were meaning making, identity, service provision, talk about it, interact with symptoms, and coping. Some simple user-friendly resources were then designed to improve the accessibility of the MYSTIC framework. The first is a toolkit with reflective questions for general and personal use, which is shown at the top of the poster. The second resource, which is shown to the right of the poster, translates the framework into clinical questions and reflections. These include creating safe spaces to talk about spirituality and mental health, and cultivating greater awareness of the centrality of spirituality within meaning making, coping, and mental health recovery. These resources, along with further details about the study and its implications for practice, can be freely accessed using the QR code and the website at the bottom of the poster. The MYSTIC framework aims to provide an accessible, evidence-based starting point to what can be a complex and sometimes intimidating topic to navigate. It aims to provide practitioners with prompts and ideas which may support conversations around spirituality and mental health. Please do get in touch if you have any questions or if you'd like any further information about the study. Many thanks for listening, and I hope you enjoy the rest of the conference.
Thank you very much, Katja.
Thank you.
I think it's set up so that the questions you asked about that earlier when I came in, that the questions should ideally be just after the presentation. So if you here in the group have questions to Katja now, that would be fine. Do you agree, all of you? We can do it.
I mean, I don't mind waiting to the end if people are keen to sort of get there. If we're a bit short of time, whatever other people want to do.
I think it would be good to have a few questions here because it's fresh in our memory. And also this is how it was described on the website. We'll stick a bit to that. But what do you all say? It's a very nice presentation, Katja.
Thank you.
Ria has a question. How does this differ from existing frameworks for spiritual care?
Well, I don't know about all the existing frameworks for spiritual care. This particular one is based on the qualitative systematic review that I conducted. So it's very much focused on what service users have said in published, peer-reviewed, qualitative research. So based on that, that's how the themes were derived and the framework. Of course, there's lots of other considerations, and I'm sure there's other frameworks that might highlight slightly different aspects. I think MYSTIC is quite broad. So it was also meant to kind of cover different understandings of spirituality, whether they're religious or not religious. So there might be differences as well in particular cultures or beliefs. So it's intentionally quite broad to cover sort of diversity of different contexts and beliefs.
Very good. Yeah, I think we're okay with time. If you have other questions here, otherwise we'll go on to the next poster.
Program, we are planning to offer these sorts of groups not only to chaplains but also to clergy, recognizing the work clergy do that's so important, providing spiritual care, but the ways that can impact their own mental and spiritual health, as well as to therapists. So we're really excited about these preliminary results, and just want to call attention to the unique work chaplains do, as well as the barriers they can often face in getting the care they themselves need. So thanks so much for your time and interest.
Thank you, Laura. That's really impressive, both in terms of multiple methodologies and conducting such a large study in such a crisis situation. That must have been a huge challenge.
I'm grateful to be part of such a wonderful team. And I'm a clinician by heart myself, so it's very powerful to be part of helping facilitate these groups.
But it's true, it's very often that we do not focus enough on chaplains to be also human beings that have multiple needs. And we found in Denmark that many times chaplains were not allowed into the clinic because they were not considered an essential part of the team of COVID, at least in the first rounds of COVID. Mm-hmm. That later changed, but that was already an existential challenge to chaplains not to be included and not to be exposed to the needs of patients. But later, the other needs that you have looked at here came out as well.
Yeah, we also heard that from many of our group members early on, how disorienting it was, how they had to kind of like really advocate to be part of the team, to, you know, to continue their work or try to do it by telehealth, and how existentially complex that can be.
Other questions to Laura? Renee just asked me to record the session. We did record the first part, but there was a break on. Go ahead if somebody of you have questions. Are you connected to Tracy Balboni and her group?
No, we're not. I would love to connect with her.
Yeah, we're going to visit them now in June, so I'll say hello from you. Yeah, well, let's we can always end up with more questions. Who else do we, thank you, Laura. We'll continue to see who else we have on the list. Who else is present who is presenting posters? Helga is, okay, great. Shall we take Helga first and then Michelle after? Okay, I'll do you the co-host.
I'm unable to share the screen, please.
Yeah, you should be able now.
Can you see? It's okay?
Yeah.
Okay. Hello, my name is Helga Martins. I'm from Portugal. I'm a PhD student in nursing, and I'm just presenting here just a small section of my PhD. I'm presenting religious involvement in cancer patients receiving chemotherapy, longitudinal study. I just want to add that also the co-author of this study was Professor Silvia Caldeira, and she also is my supervisor. Just to give you some background regarding this study, regarding the holistic approach in healthcare, it's necessary to assess the religiosity of the cancer patient in clinical practice. Religiosity, it's very important for patients, and they have also plays an important role in quality of life and lower anxiety in patients. So the aim of this study was to assess the religious involvement in cancer patients receiving chemotherapy before starting chemotherapy, after 3 months, 6 months, 9 months, and 12 months. Next, we have the methods of our study. This was a quantitative, observational, and longitudinal study, which embraces 5 cuts. The study was conducted in the hospital center in the Oncology Day unit, which included 332 participants, and the inclusion criteria were patients that were starting chemotherapy and the age was above 18 years old. We use a random sampling technique, and the data collection took place between February 2019 and May 2020. We use a self-administrated questionnaire that took about 50 minutes for the participants to fill. The questionnaire included the Belief into Action scale, which allows to assess the religious involvement. Concerning the data analysis, we perform the SPSS version 24, and the ethical issue, the study was approved by the ethics committee, and the written and oral consent was obtained by the participants. Here we have the results of our study. Most of the participants were females with an average age of 60 years old. The age range was between 22 and 83, and most of the participants, about 94%, had religious affiliations, and most of them were Roman Catholic. Since this is a longitudinal study, we have 17.5% of attrition of the initial sample, and the main cause was because the patients died during the study. On the right side of the results, we can see the scores in the 5 cuts of the Belief into Action scale, the religious involvement, and we can see that after 3 months we reach the lowest values of religious involvement. Also, our result shows that there was statistically significant difference in all 5 cuts of our study. So in conclusion, we need to emphasize that we need to have some awareness by the healthcare professions concerning the first 3 months after initiating chemotherapy, because this is a crucial time regarding the religious belief system of the patients. At the end of this poster, we have the references that I use in this presentation. So thank you so much for your time.
Thank you. Very good and very concentrated, Helga.
I try my best because I'm not an English native speaker, so I try my best to speak in English.
Questions? You can all come up with questions. You can put them also into the discussion, the chat. I can take them from there as you prefer. You can also go on with the next and then leave the questions for at the end. So we're sure that, I think we'll do that. We'll continue with Michael. Michael has to go at some point, so he's asking if he could be presenting next. Michael, if you are ready. Thank you very much, Helga. I will make you a co-host. You are co-host now, Michael. We cannot hear you, Michael, for some reason. We can't hear you yet. There must be something with your microphone because you are not muted from our end. We can see that you are not muted, but we cannot hear you. Okay, we will then continue with Michelle. Would you be ready to continue now? Because then Michael might be able to just fix the technology issues.
Sure.
Good. You are now the co-host.
Okay. Okay, do you see my screen there, the poster?
Yes.
Okay, wonderful. All right. Hello, everyone, and thank you for attending my poster presentation. My name is Michelle Solomon, and I'm a registered nurse. I've worked in acute care and ambulatory mental health, and I'm a PhD candidate at Western University in Ontario, Canada. And this research is currently in progress. I'm doing my data collection and analysis. Why am I doing this research? Promoting mental health in transitional aged youth, ages 15 to 24, is a priority due to the onset of mental illness during this time. And unfortunately, suicide is a second leading cause of death in this youth population. For those living with bipolar disorder here in Canada, 1% of people 15 years and older report symptoms of bipolar disorder, which is characterized by alternating or mixed manic or hypomanic and depressive episodes. And the prevalence of suicide in people with bipolar disorder, unfortunately, is higher than other mental health diagnoses. Psychosocial interventions are essential in investigating the management of bipolar disorder, since pharmacotherapy, although has been very helpful for many people, it doesn't fully restore mood and quality of life. And spirituality, there's been research that shows that spirituality is associated with lower rates of depression, lower rates of suicide risk, and of substance use as well, substance rates. And we also see that there's been a gradual disappearance of religious attendance in Canadians 15 years and older over the past 30 years. And there's been a rise of, this new age spirituality. However, we need to understand more what youth, how they define spirituality, how they understand it today, so that we can better support their spiritual needs, these youth who have bipolar disorder. So that's what the purpose of this study is. I'm looking at how youth describe their understanding of spirituality and how they experience it as well. And the methodology that I'm using is photo voice methodology. And I'm doing a modified photo voice study with individual interviews instead of the group interviews. And this is a participatory approach where photography is used to identify and discuss experiences to create awareness and social change. So I asked participants ages 18 to 29 living in Ontario to take photos that answer these questions. What does spirituality mean to you? How do you experience it day to day? And how does your mood relate to your spirituality? And then after this, we'll have a webinar, a group webinar to discuss the themes. And the analysis will be thematic analysis as well as value-added analysis to really create generalizable concepts and to help theorize the data. And youth will ultimately, they will share their photos and stories in an online art exhibit. And future directions and implications of this research is curriculum development in spirituality and mental health, in nursing and other disciplines, as well as in practice to help inform skills and competencies of healthcare providers that offer, for example, spiritual psychotherapy and other spiritual strategies for youth living with bipolar disorder and mood disorders, and as well as hopefully policies that support this interprofessional collaboration, education, and practice that support multi-faith spiritual development in youth. So this is the research, and thank you for listening.
Very nice. I've never heard of the photo voice methodology. Seems very, very good, especially for young people who all have a cell phone with a camera.
Yes, it's very interesting.
But it works well, huh?
It really does. I chose that method because it allows youth to use their voice to capture abstract phenomenon that are difficult to express in words. So I also ask them to journal throughout the process as they're taking the photos, and that helps with the interviews when we go over them.
So the photos are not just the stepping stone for the conversation, but the photos can be part of the empirical data itself, is it?
Yes, absolutely.
Let's see, any questions?
I just have a quick comment. Thank you for your presentation. I just wondered if you'd come across David Tacey's work, The Spirituality Revolution, because he talks about youth spirituality and developing an educational program based on their quite kind of what he calls kind of evolving spiritual ideas that he thinks kind of need more attention and understanding, in particular in relation to mental health as well.
What was his name, Katja?
It's David Tacey, Tacey, The Spirituality Revolution. Really recommend it. It's brilliant. I love this author. Yeah, I really recommend it. And he's particularly interested in how youth spirituality is kind of changing and evolving.
Thank you. I haven't heard of him. I'll definitely look that up, because I think it's, there's definitely a gap in the youth's experience today and how that's changed. So we'll take a look at David Tacey's work for sure. Thank you for that.
Thank you.
Other questions?
Michelle, a little question with regards to the data protection issues related to taking pictures of people. Did you run into any problems with that? Because we are conducting a similar study, and the issues and ramifications that there are with data protection, sometimes it's very frustrating.
Yeah, so I had to make it clear to participants not to take photos of people's faces or photos that could identify people. And so what happened is sometimes I had to say, this photo, we can't accept this photo because it identifies this person. And so we had to kind of backtrack and say, I'm sorry, can you choose a different photo? I asked them to submit 8 to 10 photos that they think best answer the research questions. And if there was something that, that I felt was not appropriate, then it just wasn't accepted. And maybe, we could discuss why they chose this photo to represent their experience of spirituality. But it's not available it wasn't published. It wouldn't be published. So, and then for the consent, we had to, they have to consent to the use of unidentified quotes and the use of their photos. But we had to make it clear not to identify people's faces and things like that. So,
yeah, GDPR.
It was tricky at first, because we had to say, I'm sorry, we can't accept this. Yeah. So.
Good. Great. Thank you very much. We will continue with Michael directly. You are already the co-host, Michael. You can continue. Thank you, Michelle.
I have a problem with finding my own presentation now.
Now you have the noise, the sound. Now we just need a presentation.
It's either one or the other. Can you log me into the virtual presentations that there are on the website, please? Because right now
I wouldn't be able to do that, but you can. I think you yourself you can press the W tab on top, perhaps. Next to the left of the Earth symbol. I cannot control your screen, Michael.
Tell me again, sorry about this. You have to continue because I cannot find it, sorry.
Okay. Let's see, who do we have next in the meantime? Marika, were you going to present? I don't remember. Yes, you were, huh?
Yes.
Do you want to continue? Then Michael can find his presentation.
Okay.
I will just make you the co-host. Let's see. Here we go. It still has some challenges doing presentations online in groups. We have to be patient with each other, obviously. But you are our co-host now, Marika.
Okay. Do you see everything?
Yes.
Wonderful. Then I will start. My name is Mareike Gerundt. I'm a research associate at the University Witten-Herdecke in Germany. And I'd like to present our German project, Spiritual Care at the End of Life. It's a development and testing of an implementation strategy as part of a pilot project. And first of all, some background information. What motivated us to initiate the project? Studies show a high need for the integration of spiritual care and existential communication into the overall care concept, especially for the seriously ill and elderly people. And so it's our primary aim to improve the spiritual and existential well-being of elderly and seriously ill people at the end of life. And we want to do this in 3 steps. Training of multipliers in nursing homes, hospices, and palliative care units by testing our 40-hour curriculum, Spiritual Existential Care Interprofessionell, short SPECI. The curriculum was developed in 2017 to 2019, and it's now a part of our project and it's tested. We want to prove the effectiveness of training, especially for the spiritual health of persons in the last phase of life, and we will derive necessary framework conditions in the healthcare institutions to improve spiritual care. The effectiveness of the training is reviewed as part of a scientific research, and as you can see in the figure, there is a pre-intervention survey 4 to 6 weeks before the training, and 2 intervention surveys 3 and 6 months after the training with 3 groups of people. We surveyed employees, full-time and volunteer in nursing homes, palliative care units and hospices who are participating in the training of our 40-hour curriculum. We surveyed residents and patients and relatives and family members of the interviewed residents and patients. The survey uses validated survey instrument. You can see a small excerpt from 2 central elements at the right-hand side of the poster. And we have not so many results, a few initial results, and they show that employees are highly motivated, but experience a lack of time as a relevant barrier to provide spiritual care. There's also personal, structural, and organizational deficits in the implementation of spiritual and existential care in the healthcare institutions. And so we see a high need for further trainings and structural changes. There's also a necessity to adapt the curriculum to the needs and previous knowledge of the respective groups of participants. Small conclusion and outlook, we need considerable efforts at the structural and organizational level to establish spiritual care as an indispensable pillar in the care of seriously ill and dying people. And we see that it's necessary to have discussions with health and policy makers and providers of healthcare facilities. And these must be based on proven facts, and we are working on that. Currently, the pre-intervention has been completed in all facilities, and the trainings are also completed, and so we are busy with the first data entry so far, and thank you so much for listening.
Bravo, Marit. That's a big, also a very big and ambitious project.
Yes, indeed.
So the main intervention is to train the facilitators. Is that correct?
Yes, the training is our main invention.
Yeah.
And then we have the questionnaires in the 3 steps: pre, post after 3 months, and post after 6 months. That's the method.
Good. Any questions at this point? We're running a bit short of time if we are supposed to finish in 3 minutes.
Yes.
Just hang on 5 minutes for Michael's presentation. Thank you, Marike.
Thanks.
I will see. I think you're already the co-host, Michael. Did you find your presentation?
Yes, can you see it?
Let me just check. Not yet. You have to press the, yes, there we go. That's
At last.
yes. But you have to
Okay.
somehow zoom it a little bit. Yeah, now we can see the whole screen.
Good. The study was based in Malta. I am Michael Galea, clinical psychologist and lecturer at the University of Malta. And we wanted to see how spirituality factors in view of traumatic loss. In Malta, by the way, Malta is very Catholic, at least on paper, like many places as well. And there are many parishes in different towns and cities. And each parish during summer, they organize a lot of fireworks and festa, etc., etc. Now, we were having a spate of explosions during these letting off of pyrotechnics. And we wanted to know, envisaging that this trauma, this tragedy was being done during a religious feast, how religiosity and spirituality does factor in. And therefore, we did this thematic analysis on a number of individuals. Basically, they were 8 individuals, relatives of people who perished, literally perished, in the last 20 or so years for festivities that were organized, financed, and done for religious feasts, for saints, basically. And in this thematic analysis, the results produce 2 key elements regarding spirituality. One, as a complicated spirituality, whereby there were some other highlighted themes, a truth too demanding, and hard feelings at God. Particularly, why did God let this happen? Why did this had to happen in a religious feast, etc. But there was also another element, another view about spirituality, which we called protective spirituality. Basically, from the abstracts, from the interviews with these 8 individuals, we factored in the living in the here and now as something that had a great impetus to these individuals, also the cohesion as a family, and the third one, the importance of trying to move on, meaning to keep your feet on the ground and just be concrete as possible and just accept what the future may bring. The strengths of this study was that it was the first of its kind in Malta. Of course, religion and spirituality are topics that very often we are inundated with, people are, and therefore we need to try to see the more realistic approach to this, particularly when we are facing trauma and tragedy.
Very good. That's a super interesting study as well. It really brings forth the whole field of theodicy, that if you believe in a good God, why does he allow for suffering in people? And when traumatic events happen that are linked up with religiosity and faith and religious events, that becomes even more acute. So I think you have really dived into it.
Thank you.
Yes. Questions? I think it's a wonderful study, and it's so nice to hear your English that you speak in Malta. It's so characteristic, so clear, and with a British Oxford accent, but also with a very distinct Maltese accent. I love that.
Thank you.
Do you know the earthquake in Lisbon in 1740, was it, or 50? I don't remember. But there was the same reaction. It was an event where it happened on a Sunday during people that were, all the people, the pious people were in the churches, and the churches collapsed on them, whereas the non-faithful were in the brothels in the outskirts of the city, and nothing happened to them. So it was the same situation, you know, where is the justice of God? And yeah, so this has been, I think every time there is a meaninglessness and a sense of injustice, the Odyssey and these reflections come up, but you have nailed them. Very, very interesting. We'll look into that.
Thank you.
Okay, do we lack any presentations? I have none on my program. I think Mona did not show up. But does anybody want to present who has not presented? Let's ask the question that way. Otherwise, I think we are 5 minutes over time, and I thank you for your participation. I will look into some of your posters myself directly, but all the best to you, and have a wonderful online conference.
Thank you.
Thank you, everyone.
Bye.
All the best.
Thank you.
Bye-bye.
God bless.